A new warnings tonight for hundreds of thousands of Americans, perhaps more, who may find themselves uninsured in the coming weeks, unbeknownst to them. Dan Mendelsohn is the former Associate Director for Health at the White House Office of Management and Budget under former President Bill Clinton. He's also the CEO and founder of Avalier Health. Dan, thank you for being here. So you're a supporter of Obamacare, but you have a warning for, we believe it's millions of Americans tonight that they may find themselves uninsured on January 1st, many of whom have no idea that's a possibility. What say you?
Yeah, the study we released today shows that there are 4 groups of people who are going to have to proactively go out and sign up for insurance in less than a 2-week period of time. So there's a deadline. It's December 23rd, and it's millions of Americans who are going to have to go out and do this.
And the first group that you focus on are the people that had their they had their plan, they liked their plan, they lost their plan thanks to Obamacare, and now have no choice really but to go on healthcare.gov.
Yeah, I think the important thing here is that the law fundamentally changes the way that insurance companies make money. And there were a lot of policies that were really just not even economically viable under the new framework. And these
but there are a lot of policies
that
were great that people loved that got canceled too.
Well, they might have loved them, but they weren't available. Again, you know, this law really changes the rules of the road for insurance companies. It limits the amount of money they can make. It limits their ability to discriminate against people with chronic illness. It really forces them to go in and structure very tight networks of doctors and hospitals so that they can reduce costs.
Let me ask you about that, because that's another thing that you point out in your report, and that, you know, small networks of doctors and hospitals is a problem for the insured. I mean, this is one of the stories we've been covering, because people are very concerned. Another one of President Obama's promises is about to be broken, which is, if you like your doctor, you can keep your doctor.
Well, you know, there's an upside and a downside to these very narrow networks. The upside, of course, is that they lower costs. The downside is that it restricts patient choice. I think one thing that has really not been pointed out is that a restrictive network also makes it possible for a health insurance company to make sure that the quality of care that is being provided is high. So, you know, they're actually getting paid now on the basis of quality. The plans are getting paid on the basis of quality. And they're moving these quality incentives down to doctors and hospitals and holding them accountable for actually
but you know the argument on the other
care.
side of that. The argument on the other side is that is if I'm getting paid only if I produce quality, I'm not going to take the sickest patients. I'm going to take only the ones I can cure.
Well, that really depends on what the quality measures are. I mean, look, if the quality measures as are used right now in Medicare are immunize people against the flu, that's not going to affect whether you take a sick patient or a healthy patient.
I know, but we've had docs come on the show repeatedly and say the quality measure, while it sounds good, will lead to the refusal of patients, of the sickest patients, which is sort of, you know, contrary to the intentions of the act.
I think a lot of doctors are not happy about being measured. And frankly, as a patient and as someone who advocates for health system change, I want doctors to be measured, and I want there to be quality incentives, and I also want there to be a system that does not penalize them for taking a sick patient.
Yeah, I mean, the question is who's doing the measuring. That's what the doctors are saying. You know, they don't want to go answer to IPAB or Kathleen Sebelius and have her in between the doctor-patient relationship, which, you know, we'll see how that shakes out. Dan, thanks for being here.
My pleasure.
Joining us now with more, our Fox News senior political analyst, Britt Hume. And that's the big question, Britt, tonight is that the next shoe to drop, that if you like your doctor, you can keep your doctor? Oh, wait, no, you can't.
Yes, Megan, that is something that reveals the fact about this whole situation, which is that, you know, the first problem was you couldn't get in the door because the website didn't work well enough to let you even come in and look around. Now the question is, you know, what horrors do you find or what benefits do you find once you get in? And for a great many people, as you're pointing out, of course, the question arises is, you know, you go in, you look around, you scout for a plan, you find one that looks pretty good, it's reasonably comparable to what you had before, maybe a little better if you have a subsidy, and then you go and look and see if the hospital you're used to going to or the local medical care facility, whatever it is, and the doctors you're used to going to are covered, or included, I should say, in that plan. And so far, a lot of people are finding that they're not. Now, you heard the argument made there by Mr. Mendelsohn as to why, you know, you compress the number of doctors and the number of medical facilities that are included, and that way you can keep a sharper eye on them. Well, maybe. On the other hand, a lot of this gets more and more toward the core of this, which is the decision about what constitutes good care.
Yeah, who's keeping an eye?
And keeping an eye is being made not by you and by your particular preferences, but more and more by some centralized authority somewhere, whether it be an insurance company or whether it being, the Independent Payment Advisory Board that you spoke of, IPAB, which is the one that got the epithet that a lot of people said was false death panel. But it certainly doesn't. It certainly isn't really what it was supposed to be, which is more patient-centered. It seems, in that respect, at least, not to be.
We haven't even gotten to the days of IPAB. I mean, we're not even there yet, Britt. This chestnut awaits the American people, and there's a real question about how this is going to play out. And of course, you think of Nancy Pelosi. We have to pass the bill before we can know what's in it. Americans are starting to see what's in it, and they're starting to see they can't keep their plan. They maybe cannot keep their doctor. They maybe cannot keep their hospital. And now it may be that they actually have a bureaucrat telling them what tests they can or cannot have. I mean, what happens in this country when we get to that point?
Well, it's not going to be popular. That's the problem with this. It's a political matter, Megan, just judging it purely as a political matter. It's possible, of course, that the scenario that Mr. Mendelson described, in which you have, a sharp eye being kept on things by an insurance company or some other supervisory authority, will constrain costs, the growth of costs. On the other hand, that doesn't mean people will be getting the best care available. It also certainly doesn't mean that people are going to get the care that they're accustomed to getting from the people and the institutions they're accustomed to getting it from. And of course, there's this issue which you've also raised, Megan, and that is that until the part of this, a facility within this website is finally built that allows the information from the website to be reliably transmitted to the insurance companies, we're in a situation where people will sign up, enroll. Remember, we're always hearing about sign-ups and enrollments. We're not hearing much data about actual purchases, because the facility for doing that is not finished. The insurance companies are going to need to know the information about who is signed up with their policies and what their premiums are going to, so they can compute the premiums or what the premiums are, so that they can then send them a bill. And until you actually get a bill and pay it, you're not fully legally insured. So that's another issue, and that's what a lot of people are worried about, because the window is so tight now, right. For people who have lost their coverage as of the 1st of January. They think they're signed up, and of course they find out that they may find out in significant numbers that they are not, yeah. Which is the kind of problem that nobody wants to have, and it's certainly not going to lead to an improvement in the poll numbers you were discussing with Chris Starwart earlier in this hour.
Yeah, and it remains to be seen just how many will show up to their doctor's office or to their hospital in the new year, only to be told that they are not insured, contrary to what they believed. I got to run.
Well, that is worrisome.
Hey, did you see me on the Tonight Show last night? I mentioned you.
I did saw you on the Tonight Show. I heard your shout out to my dear wife Kim, who was one of those who discovered you and is proud of it to this day. Thanks for that. You were good on Leno.
Thanks, Britt, and thanks to Kim Hume, too.
Yeah, you bet.
That's where it all started. Well, coming up, we're going to show you more about my appearance on Leno. I got some behind-the-scenes color for you.